put on your sort of pediatrician hat for a minute, ma'am, and help us understand this. You know, we've constantly been headlining stories trying to get the awareness of parents as well, highlighting that a child in Delhi smokes about 15 to 10 cigarettes a day without even knowing, without just breathing. Now, if every parent could understand one science-backed truth about air pollution from you today, what would you tell them?
Well, one has to do everything to protect yourself, and particularly small children, because they're smaller, they breathe faster, they are shorter, they are closer to the ground, so they actually inhale more. Plus, their organs are developing, their heart, their lung, their brain, all of their organs are developing. So it's actually very harmful for young children to be exposed to the same levels of air pollution as we are, because it's going to impact their future cognitive development. Now, this is very scary. So what can we do to protect ourselves and our children? Well, avoid the exposure as much as possible. Now, this is easier said than done. But in the most polluted parts of the day, which is generally the colder parts of the day, keep the child indoors, keep the doors and windows closed. Certainly don't go out and exercise or play during those periods, because the faster you breathe, the more pollutants you're going to be taking in. Again, an N95 mask will be able to filter out these particles, but for younger children, it's difficult to get them to keep N95 masks on, but perhaps if they are in a very outside and they can wear an N95 mask when they're moving around outside, that would be a good one. Air purifiers, again, expensive. Not everyone can afford, but I wish that schools would invest in air purifiers, that, you know, wherever one can put those in, because that certainly does help. Of course, you have to keep changing the filters and so on. And then watch out for any signs or symptoms of your child, you know, getting breathless, getting a cough and cold, and obviously get medical attention early on.
But ultimately, in Delhi are now, sorry, the doctors in
I know doctors are saying go, you know, doctors are often telling parents move away, but again, that's not practical. Yeah. So I think the problem is that individual protective action can be taken by some, maybe not all. It can help to some extent, but ultimately the air is common to all of us. It's a public good. And so we have to clean the air. That's going to benefit everyone, you know, rich or poor. The other solutions are will only impact a few.
Right. Ma'am, but I want to get down on the question of accountability here. This is a public health crisis, perhaps the biggest we have seen in India in far too long. Who do you think should be held accountable here for this health fallout of pollution? Environment Ministry, Health Ministry, local governments, like where does the buck stop really?
So this is a classical case where I think it is a collective responsibility. Now, of course, one says that. Then next step is, okay, somebody's got to take charge, to coordinate, you know, to have a plan, to have metrics, to have indicators, to have very specific actions, and to follow those through. So I am looking at it something like how we tackled COVID. We had an empowered committee of secretaries. How did we do Swachh Bharat mission? How are we doing the Jeevan mission? These are massive national programs where, you know, we've set very ambitious targets. We've got and we've achieved most of them. So I feel that it is possible to do, but because it's a topic where you have to have action across. You need financing, you need good governance, and there needs to be an empowered group of people that's actually at the top monitoring what is happening. And now I think that we have enough data, and we have enough airshed analysis, and we have enough science-backed solutions. So we are not short of solutions or anything, but we need very strict enforcement and implementation.
A select committee, that sounds like a good idea. We really hope the government sort of takes that up as well. Ma'am, I also want to understand from you a little bit of what the future looks like here. If pollution levels remain the same, what do you think will be India's disease profile looking like in the next 10 years? Are we heading into a silent sort of chronic disease epidemic of sorts, very, very unaware, very, very complacent in handling in air pollution?
So over the years, as we've seen the risk factors for health, you know, there's this analysis that's done every couple of years. Air pollution has been steadily climbing up as a major risk factor for health. And other things like water and sanitation and all those, many of the infectious diseases, those have, we've done well on them and they've gone down the list. So the number one is dietary risks, the food, the nutrition that we get. That's the number one risk factor for health in India today. The number two risk factor is air pollution. And this is contributed to by many sectors, but also by household air pollution, that is by burning of solid mass. We know that many people are still using biomass for cooking and for heating, and also waste burning happening all over the country. Big source of pollution, which is often neglected. So it is the number two cause of, and if you look at cancer deaths today, lung cancer, smoking has gone down, but pollution has increased as a cause for lung cancer among non-smokers. If you look at COPD, chronic lung disease, heart attacks, even dementia, diabetes, there's more and more data linking air pollution to all of these chronic diseases. And we know India has a young population. We talk about our demographic dividend and the fact that this is a huge economic asset for us. Well, don't address air pollution, we're going to have an unhealthy population and we're going to lose that demographic dividend. So I think this is something which has huge economic and public health importance. And if we address it, we will see the gains very, very quickly.